by popular request, I wanted to dedicate an entire video just to neck rejuvenation and neck rejuvenation treatments to help keeping your neck skin look as young and youthful and healthy as your face skin. Okay, you guys, how to treat tech necklines, neck bands, aging neck skin, surgical versus non-surgical options for neck rejuvenation. All the things I'm going to discuss in this video, so by the end of the video, you can make an informed decision on what treatment or combination of treatments may be right for you. Let's get into it. So we're just hanging around home today. I wanted to do a quick run through of thread lifts and the effects for neck rejuvenation. So thread lifts can come in many forms. There's PDO threads, there's different threads that have different kind of techniques in which you place them into the dermal planes in the skin. There's lots of different thread lifts, but for the most part, they work by two mechanisms of action. They mechanically lift up and pull and tighten neck skin. I've had it done. I had it done when I was about 41. I'm 46 now, and I feel like I'm probably due again because I feel like they've been metabolized and they've run their course and I need to do them again. They also are like a slow depot filler. So they're like a biostimulatory effect on the skin. So basically, it can stimulate your fibroblasts, which are the collagen producing cells in your skin, to make more collagen. Also a lot more elastin fibers and glycosaminoglycans and all the extracellular matrix proteins in the skin that give skin that plump, firm turgor. The loss of those proteins can cause the opposite, laxity, crepey skin, and our skin on our neck is the first to show it because that skin is so thin. Thread lifts not only mechanically lift, tighten, and pull, but they have like a slow depot, like a biostimulatory effect. So they work twofold, because when you look at before and after photos of my patients after the thread lift, there's a mechanical pulling that looks amazing. But when they come back like 3 months later, that's when they look their best, because they're also getting that component of that biostimulatory effect as well. So thread lifts are one of my favorite treatments for the neck. And again, I've done it and I wouldn't do anything to myself that I wouldn't do on my patients. Neuromodulators can actually do a lot for neck rejuvenation. And when I mean neuromodulators, I mean chemicals that affect the synapse-nerve complex and relax the muscles. So that could be Botox, it could be Daxxify, which is the longer lasting Botox or neuromodulator. It could be Jeuveau, it could be Dysport, it could be Xeomin, which is a preservative-free type of neuromodulator. There's so many on the market now. I believe there's 8 or 9 on the market now. Botox can actually help relax the neck muscles, and there's lots of different injection techniques in the neck. As a provider, I usually will only target 1 or 2 areas that are the most prominent findings clinically for someone who comes in for neck rejuvenation. Say someone has horizontal neck bands, but they don't have any platysmal bands. We'll focus on the horizontal neck bands. Or sometimes people will have just more like crepey skin, but they don't actually have the sternocleidomastoid or platysmal kind of banding patterns in the neck. So we'll focus more on like the smoothing out that crepey kind of lax skin. The problem is that I feel that sometimes people who are not as highly trained or more novice injectors will give too much Botox in the neck. And that's when you can get into some serious side effects like dysphagia. Dysphagia in medicine just means the inability to swallow. So it's not like you can't swallow, water or saliva. It's more like if you're eating a bolus of food or like a dry piece of chicken, like you're gonna have to wash it down with some water. So if you weaken the muscles enough, which has happened from less than highly trained injectors, you can have problems with swallowing, which sounds terrifying, and it is scary. Also, if you weaken the neck muscles too much when you're doing core or Pilates or like core workouts, you kind of inhibit the ability of that neck muscle to be engaged during core strength. So be mindful of that. I do about 20 to 25 units of Botox in my neck. I work out 5 days a week, and part of my workout is working out with my trainer, and I do a lot of core strength training with him, and then I do bar. And in our bar Pilates classes, we do a lot of core work like on the floor. And I never have an issue with my neck stability or my neck strength despite doing preventative Botox in my neck. Do you have your sunscreen on?
Yep.
How long are you going to be out there? Aren't the waves too big for today?
We're not big, but it's really...
You got sand all over your bed. Oh my gosh. Okay, let me see your face. Make sure you have enough sunscreen on.
I do.
You put it on yourself? Good job.
I did.
All right, buddy, have fun. Let's continue on with neuromodulators and neck rejuvenation. I have to get to a quiet place in this house with all my kids home for the holidays. We still have our Christmas tree up. Hopefully you guys don't judge me, but working mom, balancing life. I just heard my daughter and her friend are feeding Kobe, our dog, French fries. So other areas that you can inject in the neck, or different areas that you can inject neuromodulators into the neck for rejuvenation, include micro droplets of neuromodulator kind of along in like horizontal banding patterns to help relax that thin platysmal muscle that when it contracts, it can kind of like bunch up the skin and make the skin on the neck look crepey and textured. That's different than the injection technique that we use to kind of minimize the appearance of tech neck lines or the horizontal neck bands, which may not only occur with age, but could be anatomical, as many young patients have horizontal neck bands as well. So it's usually like maybe 1.5 units along the horizontal neck bands to kind of relax that underlying platysmal muscle and the superficial fascia, which contracts and can help smooth out the horizontal neck bands as well. Another injection technique for neck is when people have, let's see if I can do it. When you go like this and you have your sternocleidomastoid and you have your platysmal bands that kind of pop out, that can make us look like angry or mad or old or aged. And by doing Botox in those platysmal bands, it can kind of help soften those. Obviously mine aren't Botox because you can see them popping out right here. It's also more apparent in people who, you know, are thinner and don't have as much fat there, or, you know, they work out a lot and the muscles are a little bit stronger or more robust. So we've talked about neuromodulator for smoothing out the neck skin. We've talked about the horizontal neck band injection pattern for Botox. I say Botox, but I mean any neuromodulator in that area for the bands. And then the other thing that's really helpful and a good technique is doing a little bit of Botox into the kind of like area where there's like the AP projection, so like right here. So when you do Botox in this area, it's about 10 to 15 units, and that can really kind of tuck up and under that area, which gives a really beautiful profile angle. So when you're looking at your AP projection of the chin and you do a little bit of Botox right here or a little bit in the little banding pattern right under the submental area, that kind of tucks that up and it gives that profile to where the chin kind of tucks up and then goes down to the neck. So then you don't have that straight line that has like a Benjamin Franklin looking kind of profile, which nobody wants. So doing a little bit of Botox here to kind of tuck that under is a really beautiful aesthetic outcome. And then that's different than the Nefertiti lift, which is jawline Botox, in which we inject a neuromodulator along the jawbone, and it's right underneath the jawbone, and that is to minimize the tension or pull of the muscles going down so that the resting tone of the muscles that pull up go unopposed and just help delineate that jawline. And we usually do 10 units per side. But again, my kind of internal mechanism for myself as an injector is I never do more than 25 units in the neck, 20 to 25 units in the neck, because then that's just too much and it's overkill. And then you get into, you know, the concerns for dysphagia or, you know, neck weakness when you're working out. So that's pretty much all there is to know about neuromodulators and the effect on neck rejuvenation.
Hey, don't worry.
Okay, bud. Have fun. He usually surfs for like 5 to 6 hours a day. And it's pretty connected with the ocean, so that makes me happy. The hardest part of being a parent is like letting go. But I know my son reapplies his sunscreen. I'm tracking him, and I just love that he's so connected with the ocean and with nature. And the fact that he reapplies his sunscreen, I'm a happy mom and a happy dermatologist. Okay guys, don't judge me. We still have our Christmas decorations up. So the next thing that I wanted to talk about was filler in the neck as well. What are you guys doing? Hi! Okay, there's certain fillers that are acceptable and certain fillers that are not acceptable when it comes to rejuvenation of the neck. So, March, look at this. I just wanted to show you guys. Some of you have asked me what this picture is. This is one of my son's favorite surf spots, an aerial view. So, moving on, filler for neck rejuvenation is really, really tricky because biostimulatory fillers like Sculptra, which is polylactic acid, and Radius, which is calcium hydroxyapatite, will help stimulate the fibroblasts, the collagen-producing cells, to make more collagen. And what that does is that will help tighten the skin and gives skin those extracellular matrix proteins that tighten and rejuvenate the skin without the mass effect of like a hyaluronic acid blob of filler sitting in the neck. So a lot of people will make the mistake of using like an HA filler like Kybella or Juvederm to like fill in horizontal neck bands. It looks terrible. You can see the filler through it, especially with that thin neck skin. You can see the filler, the hyaluronic acid filler through the neck skin, and it looks terrible. So you want to do biostimulatory fillers like Radiesse or Sculptra in the neck. I'm not a huge fan of Sculptra in the neck. I love Sculptra for other areas for rejuvenation, like the mid-face. I love it for booty volume and booty growth. I actually do it in my booty every 2 years or so. But I don't like it for the neck because it does have a higher incidence of nodules. I love Radiesse for the neck, but you have to be very careful because Radiesse can also cause nodules. If that should happen, there's a protocol that we follow to dissolve those nodules, but it's not as easy as, you know, hyaluronidase that we use to dissolve HA filler. It's more of like a 3-part treatment of injecting saline into the nodules from Radiesse to kind of dissolve it. But I do love Radiesse because the data is, I feel like, the strongest in supporting that that biochemical filler and biostimulatory effect of the filler. SkinVive, which was a recently launched injectable, they don't call it a filler, but it's pretty much like a hyaluronic acid filler that was engineered for texture, and it was engineered for improving the texture of the mid-face. We use SkinVive a lot for neck rejuvenation with great results, and my colleagues have also presented their before and afters at meetings, and it is well respected among the medical community, SkinVive for neck rejuvenation as an injectable too. There has been a lot of talk and hype about PRP and PRF for neck rejuvenation. The problem is that with PRP and PRF, those results never last long enough. It never lasts for more than a month, and it isn't even certain if PRP or PRF with or without microneedling is actually doing anything, because half of it's just the swelling that temporarily makes the neck skin look better, and then once the swelling from the modality in which it's being injected into the skin wears off, then you're back to baseline. So I'm not a big fan of PRP or PRF. It's a lot of, you know, hype and marketing, and it sounds sexy, and they take your blood and they spin it down, they take the supernatant and they inject it back into your skin, and it sounds amazing, and they charge you an arm and a leg for it, but honestly, from a scientific background, it doesn't really do anything at all. One of the most rewarding jobs, but one of my hardest jobs, is being a mom. Not only a mom, but being a present mom, because I don't want to miss a beat. Time goes by so fast and they grow up so fast. I had my kids when I was still in school and in training. I missed out on a lot because I was working, you know, 80 hours a week and taking my boards and going to grand rounds and presenting at LA Metroderm and going to conferences and all that stuff. So I try to make up for it now with my kids by just balancing motherhood and being involved in my kids' life while being in the office and seeing patients, and then, you know, being a professor of dermatology and teaching the residents and the med students, and then doing YouTube for you guys. So it's kind of a balancing act, but I do prioritize my time with my kids because that is just so important to me. This is the first board where he first won his very first surf competition. There's like sand on the floor, constantly sand in the room. And now I have to go find where my daughter and her friend are because they had a sleepover and I haven't seen them in an hour, so I need to find out where they are. They're being a little too quiet. I have a feeling they're in here. This is their little hiding place. You guys.
Yeah?
What are you doing in there? Hi. Oh, but not here yet. It's on its way. Let's talk about devices for neck rejuvenation. So we have lasers and we have energy-based devices. Energy-based devices just put heat in some type of form into the skin to stimulate collagen synthesis, elastin synthesis, and all those extracellular matrix proteins that help tighten the skin. Because the loss of those proteins, as we lose 10% of collagen each decade, which is a sad but true fact that starts at age 20, we lose that taut, tight turgor to the skin. And that's because there's a loss of collagen and elastin. And when you look at skin under the microscope, you see these fragmented collagen and elastin fibers that correlate with what we see clinically with kind of like crepey skin on the neck. So devices like Thermage, which is one of my favorites, puts radio frequency heat into the skin, and that upregulates synthesis of collagen fibers. Now, The mechanism of action in which that happens is it's a very controlled wound healing environment. Now, I want you to be careful because you're going to see plastic surgeons and people who want to operate on you saying it causes scar tissue and it makes having a facelift or a neck lift later on impossible. I can speak as a dermatologic surgeon who's done thousands and thousands of rotation flaps and grafts and surgical reconstruction on the neck, the face and skin that has been treated with Thermage without any complications at all. So because I wear many hats and I've had many levels of training, I can speak as a dermatologic and cosmetic surgeon and as a minimally invasive non-surgical dermatologist that these energy-based devices induce healthy collagen stimulation. That is considered a wound healing environment, but anything that increases collagen is considered wound healing or induction of scar. Collagen under the microscope is what scar looks like. So anytime you have a scar, whether that's a keloid scar from trauma or you have a surgical site, if you look at that skin under the microscope, it's chock full of collagen. But guess what? Healthy, beautiful skin and young skin is chock full of collagen too. So be careful because there's a lot of marketing ploys out there that will say, increases collagen, increases scar formation, and will decrease your, your response if you ever want to have surgery. That's just not true because it's like a play on words, and I really feel like it's misleading marketing that's used for the public. But I want you guys to be smarter and more knowledgeable and be better at deciphering statements like that when you come across them online. So when there's heat or injury to the skin responds by making collagen or making a scar, if you want to call it that. If you burn yourself like on a curling iron and your skin at the time looks a little pink and it hurts like hell and it doesn't show much significant change, but weeks later and months later you get almost like thick keloidal hypertrophic scar formation, that's because there's an increase in collagen in the skin. That also helps smooth and tighten the skin. If you look at like a burn victim, their scars are very disfiguring, but if you look at that skin that's scarred, it's smooth, it's tight, it's plump, and it's not aging or getting wrinkled at all. But so what these devices like Thermage do in a very controlled, very elegant, and very a very scientific manner is they put heat in the skin in the form of radio frequency, or say for Ultherapy or soft wave, it's ultrasound, or for other devices, it's microwave heat. They put heat into the skin and that stimulates collagen to lift, tighten, and firm the skin, but they keep the top layer of the epidermis cool. So when you're actually having a Thermage treatment, patients will often say, it feels cold, but it feels hot. It feels warm, but it feels cool. But that's because the transducer that goes on top of the skin keeps the top part of the skin cool, and it's heating. There's an arc of radio frequency that goes through the handpiece from one pole to the other that stimulates the skin to produce collagen. And the way that it does that is by heat formation. So skin responds to heat stimuli by forming collagen. So we use that to our advantage, and that's how Thermage works to lift and tighten and pull the skin. Other energy-based devices like Thermatite, soft wave, Ultherapy, they do the same thing. I'm not a big fan of those because I've used them all. I've been in offices where I have all these devices at my disposal. So when I started my own practice, I wanted the creme de la creme, the devices that performed the best, had the happiest patients, and the most consistent outcomes. So yes, I love Thermage. It's not to say that I don't like soft wave or Ultherapy. I think they're okay, but pound for pound, I feel like Thermage gives more consistent results and happier patients on a time over time basis. Now, in the wrong hands, of course, it can cause melting of the fat or some deleterious outcomes, but that's usually for people cutting corners using outdated platforms that are refurbished and not the most updated technology or devices, or they have a device operator or an extender who doesn't really know what he or she is doing and is making all kinds of mistakes. So combining those two is like the formula for disaster. So, but when in the right hands, Thermage as a tightening device for neck rejuvenation is amazing. I've done it 4 times. I did it when I was 30, I did it when I was 35, when I was 40, when I turned 45. And that's been one of the best things that I could do for my neck rejuvenation. I also had thread lifts, PDO threads. I had 6 on each side. And when you guys look at my older YouTube videos and you're like, dude, your neck was a hot mess in your 30s. I also had like a toddler and a newborn. It was still in school and struggling, and I didn't have time to do these treatments on myself. I was just doing it on my patients. That's why my neck looks so horrible, but I have done thread lifts as well, and I have done Thermage 4 times. I also Fraxel my neck. at least twice a year, usually at least once a year, but sometimes twice if I can. And Fraxel and lasers are another good way to rejuvenate the skin through collagen stimulation, elastin fiber synthesis, and also getting rid of old damaged skin proteins and sun damage and replacing it with healthy new collagen and healthy new skin cells that act and behave younger and give a rejuvenated look to the neck. And these two little girls drinking their boba in their little storage area. I don't know why you guys like it in here instead of your bedrooms, but your little fort. Oh, the box? Oh yeah, I'm gonna give you the box right now. You're welcome. So many people may ask, why is she vlogging like in her bathroom? Honestly, you guys, this is the only quiet place in my house that I can get this video done. So sorry that I'm like in my bathroom here, but it's just you and me, and we're gonna get through this content because I want to educate you guys and empower you guys to make decisions when it comes to choosing treatments for your own neck rejuvenation. So lasers, what can lasers do for the neck? Lasers help remove skin cells that are damaged. They can also increase, skin cancer if they're not treated. So for neck rejuvenation, I love Fraxel. Fraxel not only helps make the skin look and behave younger, but it also has been shown in a recent Harvard study to decrease the incidence of skin cancer by 50%. So the reason why that happens is this applies not only to the neck, but to the skin on the face and the chest and other areas of the body. Healthy, youthful looking skin doesn't have a lot of sun damage because people who are young have not had those environmental exposures to cause sun damage, which can actually age them and increase the risk of skin cancer. When you do fractional or fractionated resurfacing non-ablative devices or even ablative lasers, it reverses that sun damage, which is not only going to decrease your risk of skin cancer, but it's going to make your skin look better. So one of my favorite treatments for the neck is Fraxel. Clear and Brilliant is a baby Fraxel, which I like to do on the face because there's no downtime and no pain. But to be honest, a Clear and Brilliant laser isn't strong enough to rejuvenate the neck skin. If somebody's coming in to see me for neck rejuvenation with a laser, I usually recommend a Fraxel, which is a non-ablative laser resurfacing device. And you can do an ablative laser like an erbium or a CO2, but sometimes I feel those are too strong. They'll definitely make a big improvement, but there's a lot of downtime and there is discomfort that is, proportional to how aggressive the laser is. So with the more aggressive lasers like an erbium or a CO2, ablative laser, they're going to have more pain and more downtime. But I feel like a Fraxel is one of the best lasers because it's non-invasive, it's non-ablative, it's non-invasive. The downtime is not terrible. It's not as quick and easy as a Clear and Brilliant, but it's maybe 4 or 5 days of a little bit of redness, a little bit of swelling that is, very easy to hide with a turtleneck or a scarf, or if you're doing it in the summer, by something that can cover your neck up. And it just really gives beautiful results. And my patients who have been doing Fraxel treatments every year for a long time, my beauties who are in their 7th and 8th decades of life, women in their 70s and 80s who have been doing Fraxel treatments once a year on their neck, not only do they not have skin cancer, but their necks look amazing. And even if someone has a neck lift and you lift, tighten, and pull and you do a whole neck lift, if the texture and the quality of your neck skin is poor, it'll still age you and it'll still look bad. I don't care how much skin you remove and how much you tack it down and suture it. If the skin quality, we always say as surgeons, it's like suturing wet toilet paper. Gravity's going to take a toll on skin that doesn't have a lot of collagen, even if it's been operated on, and you're going to get back to close to where your baseline was before. I remember I had a patient almost like a year ago, it was a while ago, but she came in and she's never taken care of her neck, never used sunscreen, never used Retin-A, and never done any lasers or procedures to increase collagen stores, but she just had a neck lift. And she looked great for about a year afterwards, but then she came back a year later and her neck skin was almost at the same place it was before surgery because she didn't do anything to increase her collagen stores. So those results don't last. In my history of seeing patients and with my experience, don't last unless you do things to keep up collagen stores in your neck skin. So even if you've had a neck lift, you've got to keep up your collagen stores. Use, neck tight serum or use serums for the neck that are going to increase collagen synthesis and elastin synthesis. Do a laser once a year. Protect your investment of having surgery because you could be totally pulled tight, but if the skin on your neck is poor quality, it'll age you anyway and your results won't last. When it comes to lasers, there's also specific lasers to treat certain changes that happen in the neck, and I'm actually a good example of it because you can even see in this video I struggle with melasma on my neck. I have it under control on my face, but for the neck, sometimes it's a little bit harder for me. Again, we live on the beach. It's January now, but you can see it's sunny and my son surfs and he's a competitive surfer and I no matter how much I'm out there and I'm kind of wrapping myself up and in the shade and using sunscreen, I still, even from heat, will sometimes get melasma on my neck. And the treatment that I do for myself and I do on a lot of my patients is called picotoning. So pico laser is a picosecond, which is a very fast laser. Picosecond is a trillionth of a second, and it's a very fast laser. Sorry about my daughter and her friend. They just had a sleepover. That is a picosecond, which is a trillionth of a second. It's a very fast photoacoustic instead of photothermal reaction. And what in English that means is that there's no dissipation of heat. So you don't have to worry about hyperpigmentation from the laser. And it's really great at erasing melasma. I actually just had a treatment with it. Hi guys, what do you guys think of pico laser?
I love it.
You love it? Riley, what's your favorite laser?
Pico.
Pico laser. How fast is a pico laser?
It goes up.
Picosecond.
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 It goes at like picosecond. That's why it's called a pico laser.
What type of skin cell makes collagen?
Called fibroblast.
Fibroblast. Good job. Good job, baby girl. Okay, go play.
Wait.
What?
Did she answer?
She answered it right. You get an A+. I always like to start my little budding dermatologists on their quizzing of lasers. Okay, Riley, what's the best laser to get redness out of the skin? V-beam. Okay, Natalie, what's your favorite laser for anti-aging?
I just forgot. Fraxel.
Fraxel.
I like pico.
You like pico laser? You like Fraxel? Okay, good. You guys, little budding dermatologists. Sorry, I just got totally distracted. But I just had a picotoning laser treatment on my neck about 3 weeks ago, and in another week, which will be a month, I'll do it again, and I'll do a series of 3 of those treatments, and it really helps erase hyperpigmentation from melasma, which even if you use sunscreen and you photoprotect, sometimes, especially on the neck and the chest, you can get melasma from just heat. You know, we get it from hot yoga, we get it from warm environments. Sometimes that home LED masks and devices can cause, you know, hyperpigmentation and melasma. So because I get it on my neck, I usually once or twice a year will do a series of 3 picotoning treatments on my neck. I try not to use hydroquinone too much, but if I really need to, I'll use a hydroquinone as well to help suppress the melanocytes and suppress their melanin synthesis. So if you combine lasers with skin brighteners like hydroquinone, it really knocks it out of the park with results. I typically use my neck tight serum on my neck. I use it twice a day, morning and night. Sometimes if I can get a 3rd dose in there, I use my MDAiRE neck tight serum as well. It has argireline in it, which is like Botox in a bottle, which helps smooth the texture of the neck skin. It also has some melanocyte inhibiting actives in it that are safe for long-term use, unlike hydroquinone, which you don't want to be on for more than like a 3-month period. If it's a 4%, sometimes we can have it, you know, be a little bit longer duration, but for most intents and purposes, it's usually more than 3 months is kind of contraindicated for hydroquinone use. And then also you can use V-beam laser. V just stands for vascular. V-beam is a 595 nanometer wavelength laser which targets chromophore of hemoglobin, and in English what that means is it's a laser that targets redness or blood flow. So sometimes you can have an entity called poikiloderma of Savant, and that's just when you have this mottled kind of ruddy appearance to the neck and chest skin, and that's a combination of like pigment, which is melanin, vasculature, like broken blood vessels, broken capillaries, which gives us red, ruddy appearance to the skin. And we do V-beam laser on the neck a lot to help rejuvenate the neck by retracting those blood vessels back, stimulating collagen and rejuvenating the neck. So picotoning is my favorite laser for pigment on the neck. V-beam is my favorite laser for poikiloderma of Savant, or the kind of red, ruddy appearance to the neck skin. Fraxel is my very favorite laser for collagen stimulation and for kind of tightening and smoothing the contour of the neck skin. And then, you know, a CO2 or an ablative laser is a little bit too aggressive, but sometimes in really severe cases where there is a lot of rejuvenation that needs to happen in the neck, I'll go to those devices too. Let me make sure I'm not forgetting anything. Sometimes we can do a clear and brilliant on the neck. Clear and brilliant is a very very low level Fraxel. It's what we call a baby Fraxel. There's 2 wavelengths that we use, one for pigmentation, which is the 1927 nanometer handpiece, and one for texture, which is the 1440 nanometer handpiece. And we combine those for neck rejuvenation rejuvenation. There's no pain or downtime, which makes it nice. But like I said before, I feel like Fraxel for the neck when you're in it for rejuvenation is a lot better than Clear and Brilliant. And I don't usually recommend Clear and Brilliant for the neck skin. It's usually what I recommend for the face. So sometimes patients will come in and they'll have a Clear and Brilliant treatment on their face, and then we'll hit the neck with a Fraxel. The only other thing we really haven't talked about is microcoring and microneedling. You guys know I'm not a big microneedling fan. The results are always suboptimal and underwhelming. It can be very expensive, and I don't really feel it works that well. That's why Medi Spas and other offices who offer microneedling have to rope you into a package, because it's not their response from the first treatment that's going to bring you back for your second and third treatment. You hear the little pitter patter of running feet upstairs. Sorry, it's just real life. But they rope you into a package, so you have to return for your second and third microneedling treatment because you've already paid for it. And even in my office as a provider, I never do packages. I want people to be so stoked with the response to their first treatment that they schedule a second, or they love the first treatment and they're like, let's cross over and do a different mechanism of action and do a different treatment to like augment this response for this, you know, treatment area, whether it's the neck or under eye or lower face or whatever area that you're trying to improve on. So I'm not a big fan of microneedling, but microcoring, which is Ellacor, has actually proven to be very beneficial in the neck area. So microcoring, which is Ellacor, was FDA approved for the treatment of rhytids, which just means wrinkles on the lower face. It helps rejuvenate and pull up and tighten the skin on the lower face to treat moderate to severe rhytids on the lower face. With my experience with Ellacor, and I participated in the clinical trials, I was very impressed during the clinical trials with the rejuvenating effects of Ellacor. The patient candidate selection that we usually treated were patients who were more mature and had more laxity and thinner skin. These people do better with Ellacor than patients who may not have that much laxity or not that thin of skin, but just want a little tightening effect to help with lower face gels. But Ellacor is really, really great for thin skin, very severe fine lines and rhytids, because it helps by skin excision by taking out little microcores of skin to tighten up that skin. Now fast forward to this video where we're talking about neck rejuvenation. It's off-label to use microcoring on the neck, but we're seeing beautiful results with it. And hopefully by the time we post this video, but I'm probably posting it tomorrow, if I can get some before and afters from my office for patients who have given consent to release their before and afters, which is sometimes hard to get, and I want to respect patient confidentiality, we've had beautiful results with microcoring for neck rejuvenation. And the downtime is actually less than it is on the face. I'm not really sure from a physiologic standpoint why neck rejuvenation Ellacor has a faster healing time than lower face Ellacor treatments, but it does, and people do really, really well with it. So you'll look kind of like sunburned and like bruised on the neck for maybe 3 or 4 days, and then it resolves pretty rapidly, and then you're back to how you were before with a little bit of tightening effect. Sometimes it takes more than one treatment. So with Ellacor for neck rejuvenation, we typically recommend 2 to 3 treatments spaced about 1 or 2 months apart for best results. And we've had actually a lot of male patients with Ellacor for the neck with really impressive rejuvenating effects and results with Ellacor on the neck. Let's talk about Kybella. So I'm in my bedroom, my phone is charging. So I've just taken you guys around my house with me today, doing chores around the house and watching kids. So Kybella is deoxycholic acid, and it's a fat dissolving enzyme. It naturally occurs in the GI tract, and Allergan, which is a pharmaceutical company in cosmetics, harvested that enzyme for our benefit in aesthetics, and that is to decrease fat in areas we don't want it. We use it for body contouring all the time, abdominal fat, bra fat, back fat, all the things, but it's FDA approved to help minimize submental fat, aka the double chin. That fat that you get when you go like this, you get this like submental fullness. Well, hopefully I don't have it, because I did Kybella like 5 years ago. And that's the other beautiful fact about Kybella is once you do it, your results stay. As long as you don't change your diet or exercise regimen, you can't grow new fat cells once they're destroyed by Kybella. Your existing fat cells can get larger or smaller if you have fluctuations in your diet and exercise, but you'll never grow new fat cells. So if you've had Kybella and you maintain status quo with your exercise and diet, you'll never get that double chin back. But what the Kybella in the double chin area can do is it just helps delineate that jaw neck junction. So sometimes when people have a lot of submental fullness, or they have like a double chin or a lot of fat under the neck, your face and neck kind of blends into one unit, and that's not aesthetically pleasing. When you melt that fat underneath the chin, you get that kind of sharpening of that jawline, which is beautiful. And it's not that you do Kybella in the neck, because this video is on neck rejuvenation, but when you do it in the submental fullness, it can help accentuate and kind of tighten up on the neck skin. Now, fun fact, Kybella was FDA approved for reducing fat. They were going to do secondary trials to show its effects in skin tightening, because all those inflammatory cascades that happen when you do Kybella, because when you do Kybella for submental fullness or the double chin, you get really swollen. That's like the biggest downside of Kybella, is that you have to walk around with this like goiter looking like neck swelling that looks terrible. But when you have all those inflammatory cascades, all those signal transduction cascades going on, all that fullness, all that swelling, that's also stimulating your body to upregulate collagen synthesis and cellular renewal. So there is a little bit of a tightening effect by Kybella. And they never did the FDA trials to show it, I think because of just funding. It takes a lot of money to do a clinical trial, but it's kind of a fun fact, because with Kybella, you do get a little bit of tightening. But you have to be careful with patient selection, because I'll see patients in my office and I'll say, you're not a candidate for Kybella because their neck skin is too laxed, and by melting fat it can make the neck laxity worse. But for people who have good skin turgor, when you pinch the skin and if it doesn't stay and it snaps back, even people who are older but take like really excellent care of their skin, so they have more youthful looking skin than their chronological age corresponds to, they'll get a tightening effect from Kybella sometimes. So it's just really important to go to a provider who's very astute in clinical diagnosis and getting the right candidate for Kybella, because not everybody's going to be a great candidate for it. Another thing is Coolsculpting Mini. Coolsculpting Mini is a cool sculpting device. It's a fat reducing device. I'm not a big fan of it because we saw a lot of side effects from it. And with Cool Mini, I feel that it's a cool sculpting device that goes on that submental fullness to treat that submental fat, but I feel like it can increase skin laxity. So sorry, I don't want to say anything negative about a company or a device, but I just feel like, unlike Kybella, which may have a little skin tightening component to it, Coolsculpting Mini does not, and it's great at reducing fat, but I don't feel, in my opinion, it's worth the side effects or, the risk associated with that treatment. But decreasing the submental fullness can really have rejuvenating effects on the neck overall. You just have to find the right one. Oh, also liposuction, you have to be careful with submental fullness and liposuction in the neck, because I've seen a lot of cases post-liposuction, post-operatively, where you have weird topography, uneven texture, scarring. So just be careful with liposuction on the neck, because that could be a tricky area too, you guys. That's why I like the minimally invasive treatments better, because I feel like they're more natural looking and the side effect profile is a lot less. Putting on my hat and about to go pull my son out of the water. He's been surfing for about 6 hours straight. As a dermatologist, I've spent my whole life on the beach. I've always managed to stay on the coast of California because I'm a beach girl and I live that beach life. And now I have a son who is a competitive surfer and loves the beach and the ocean as much as I do. But the ironic thing is that most dermatologists are usually like covering themselves up with like sheets and hats and face masks and not even ever going in the sun. But I want to be a testament to show how important it is to photo protect, take care of your skin, reverse and protect your skin from sun damage, do lasers once a year, use your sunscreen, reapply your sunscreen, and do all the things that it takes to have healthy skin while still living that beach life. You can still surf and play in the sun and have fun in the sun, but you're seeking shade when you can. You're applying your sunscreen and setting a timer on your phone to reapply your sunscreen. I think the ironic thing is I am a beach girl and live that beach life, but at the same time, at almost 50 years old, I am a testament to the impact and the importance of photo protecting yourself and the impact that it can have on, your skin health. How was it out there? It was so fun. Good. He has all the sunscreen on, and it's a beautiful day. He always reapplies, and he puts it on himself. He's so good. You do. All right. Have fun, bud. I love you. Yeah, I'm going to stay here and watch you. So sometimes it is a combination of treatments that can be used for neck rejuvenation. For example, if you're combining like a Fraxel laser with a thermage, or if you're combining a chemical peel with a laser, or say you do thread lifts with a little bit of jawline filler, or thread lifts with a chemical peel or a laser. Sometimes there's a lot of different combination of treatments that can really help rejuvenate the neck without surgery. And there's different combinations that you can do, and it doesn't have to be all at the same time. They can be done at different points in time. But say, for example, someone does, you know, thread lifts, and then after that they do a little Botox to kind of fine-tune, you know, the skin on the neck to make it look better. There's no right or wrong way or combination of treatments that is the right or wrong way to do things. And with each individual patient, it's important to consider their anatomical changes that they're experiencing in your neck and to target each one of those problematic areas with the appropriate combination of treatments, which may be different for everyone because you have to do it on a customized patient by patient basis. Sorry, I'm like totally out of breath. I just had to go up all those stairs. Now we're at a different beach that's a couple blocks down. Depending on the tide and the swell, there's different beaches that these little guys hop around to catch the best waves. So here we are. So I'm actually here at the beach to take clips and videos of my son surfing, but since I'm here with a camera, I want to vlog and explain neck rejuvenation to you guys and make a video for you guys. So I can do both. I'm going to be a surf mom and take videos and clips of my son surfing, and in between waves I'm going to vlog and educate you guys and talk about neck rejuvenation treatments. How's that sound? Multitasking, a mom balancing. Another topic that comes up a lot is what's the difference between surgical and non-surgical treatment options for the neck. And for some people who aren't ready for surgery, or for some people whose surgery isn't an option, the non-invasive, minimally invasive techniques. Oh, here's my little guy. I'm such a proud mom. So minimally invasive procedures can actually do a lot. And even if you plan on having a neck lift or surgery one day, it's not like it's going to be a wasted treatment because your surgical results will last longer. Your surgeon will essentially be operating on skin that has more collagen and is histologically younger than someone who's not doing rejuvenating treatments for the neck. So if you want to do a Fraxel, or if you want to do a thermage or a chemical peel, or use medical grade skincare products specifically for the neck and décolleté, it's not like a waste if you end up having a neck lift or surgery, because your surgical results will last longer, your results will be better, and your skin will be healthier, you know, from a histologic standpoint. So I think it's always a good option to invest in minimally invasive and non-surgical options, even if you plan on having surgery one day. And I'm not just saying that because I'm a dermatologist and I'm not a plastic surgeon. I'm saying that because I see skin every day, and I see people who have neck lifts and I have surgery, and I see what the results look like and how long it lasts. And I do feel that the people who do the best with results and outcomes are people who invest in doing minimally invasive treatments before having surgery and maintaining those surgical results after surgery with minimally invasive treatments for neck rejuvenation.
Petey.
You never even said hi to me. You never even said hi. You never said hi. What is wrong with you?
Petey, what's your favorite neck rejuvenation treatment?
Sunscreen.
Oh, good job.
Was that right?
Prevent. That's a good one. Riley, what's yours?
Wait, what was the question?
What's your favorite neck rejuvenation treatment?
Dermatitis.
Not dermatitis. That's a diagnosis.
Why are you saying dermatitis?
Babe, what's your favorite one?
You said
Vitamin C.
it.
No, your neck rejuvenation treatment, like a treatment.
Oh,
Oh,
not
sunscreen.
prevention?
Sunscreen.
Yeah.
Sunscreen.
Fraxel.
Sunscreen.
Fraxel, good job.
Oh, wait,
Nothing
no,
gets an A plus.
No.
Laser beam. What laser?
Pico.
Oh, Pico. Good job, baby. P, what's your favorite laser for the neck?
The skin laser.
Right. Thank you. Hey, Petey, don't be mean to your sister. All the love. So just to be honest too, I want to show you my spray tan not lasting very long and exfoliating off after I used a 0.025 Tretinoin mixed with Neck Tight, which is a neck and décolleté serum by MDAiRE, my line that I engineered for the neck and décolleté specifically. So when you use retinol or you use tretinoin or you use an active like an alpha hydroxy acid or vitamin C or retinol, it's going to exfoliate the skin in a very natural, healthy manner. But if you're like me and you do a spray tan or like a non-UV self-tan, you'll get this kind of like exfoliation yucky phase. And that's a small price to pay. It's worth it to me to have the benefits of using an active on my neck and décolleté than to just not use an active and have my spray tan last longer. So today's January 5th. I had a spray tan for a New Year's Eve event, the day before New Year's. And so this was like a week later, it starts like exfoliating off. So you can see my healthy skin underneath is the pale skin, and that spray tan that's exfoliating off is just a byproduct of me using a tretinoin. So when I use a tretinoin on my neck and chest, you have to be really, really careful because the neck and décolleté skin is thinner and different histologically than skin on the face, and that's why. So I know you guys are gonna ask me what I use. So I use Neck Tight Serum from MDAiRE. MDAiRE is my line that I engineered, and the reason why I wanted to engineer it is because for the last 10 years, some of my favorite medical grade skincare products were getting bought out by bigger pharma companies and getting taken over and changing their formula. And I just wanted a consistent, pure, highly innovative line that I could directly give to my patients and just know that it's not going to change or have actives being swapped out for cheaper active ingredients and have the most updated innovative technology. As a matter of fact, I don't know if you guys know this, but board certified dermatologists, after you take your dermatology boards, after residency, you have a 10-year period where you're board certified, but then after that, for your maintenance of certification, you have to take quarterly exams, and the quarterly exams are given by the American Board of Dermatology, which we call the ABD, and they keep us up to date with new information. The information that we get tested on the boards to keep the dermatologists in the United States up to date on the latest and greatest, I take that information and I take notes. And when I'm taking, for example, the biologics or the bioactives or the cosmeceutical section of the exam, they'll tell us, the most updated information with innovative technology, the best actives, new scientific breakthroughs. And I literally take that information that I get when we're taking our recertification exams for the dermatology boards, and I send it to my personal chemist who I formulate with. And these products are constantly adapting with the times, new innovation, new technology, new active ingredients, and I just skip that middleman to where I could literally take information straight from the research labs and straight from the medical community and put them into my products and give them to you guys. So on that note, the Neck Tight Serum was engineered specifically for the neck and décolleté skin. Being a Mohs surgeon, I looked at skin for decades under the microscope, and I appreciated the difference in the histological composition of that skin. And these actives and vehicle delivery systems are specifically engineered to rejuvenate the neck and décolleté. So this is what I use on my neck and décolleté twice a day, once in the morning and once at night. And once a week, I will mix my Neck Tight Serum with a 0.025% tretinoin. And because I do that, and if I do get a spray tan, it just kind of like exfoliates off. But when my spray tan is off and my skin is just at its baseline, just raw without anything covering it, it's baby soft and it's, baby skin. And I do Fraxel on my neck and décolleté either once or twice a year. And I have since my 20s because I wanted to keep that skin healthy. Not only just for a cosmetic look of your neck and décolleté, but also because it keeps your skin healthy. And even when I was younger doing these treatments, it wasn't even for anti-aging because I was young and didn't need anti-aging, but I wanted my skin to be as healthy as possible. And now that I'm in my mid to late 40s, it's really, really paid off, and it's something that I'm really happy that I did. Also, spending my 20s and 30s working in a hospital and being in a library studying like the big nerd that I am, I think that also helped protect me from photo, damage over the years. So I don't know what it is, but I'm glad that I was so neurotic with my skin, especially on my neck and décolleté when I was younger. So that's paying off now. If you look at my older YouTube videos, a lot of people will comment. Some people are really mean and they're like, you're in your 30s and your neck looks like crap. Like, what did you do between then and now? I did do thread lifts. I did do like thermage and how to like up my game with my neck and décolleté and even my face at that time, because I'll do a whole nother video on it, but I was in a time in my life where I was just grinding, you guys. I was working almost like 80 to 90 hours a week. I had a newborn. I had a toddler. I was doing 10 Mohs cases a day, which is skin cancer surgery, which are very long days. I was super strung out. I was really working hard, and I was doing all these treatments on my patients, but really neglecting myself. especially after having 2 kids and breastfeeding both kids, and just my whole life was dedicated to my patients, my kids, my family, and I neglected myself. And then when I turned 40 and when I was 41, I'm like, damn, I need to like reverse the clock and do these things for myself. But you know, I understand too, as a dermatologist, most of these treatments are only skin deep, and I'm going to need a neck and lower facelift, and I will do that at one point. But in the meantime, using products like this and doing laser treatments and device-based treatments and non-surgical treatments in the interim will really help maintain that skin envelope and keep it tight and rejuvenated. So, but that doesn't mean I'm not gonna have surgery. I'm definitely gonna have surgery one day, and I'll take you guys along with me, as long as everyone's nice and not judgmental. So I'm gonna show you guys how I put on my tretinoin when I use my actives on my neck. So let me show you. So here is a topical 0.025 tretinoin, and I take a pea-sized amount, which is like literally like that. I'll make it look more like a pea. And then I take my neck tight serum. So twist open, and I'll do, that's 1 pump, and then that's 2 pumps. I usually do 2 pumps, so it's like equal parts, pea-sized amount with my NMF hydrator, and then I mix it up in the palm of my hand. I can't do it like backwards in the camera. So I kind of mix it up in the palm of my hand. And then I literally apply it to my neck. And you always want to... Mom, if you're watching, I know you taught me how to do this when I was really, really young. So thank you. And I do have melasma on my neck, but it's a lot better after doing pico toning. Like, I think it was like 3 weeks ago. So that's it. These 2 together. Once a week. I wouldn't do it more than once a week. And you guys are gonna say, oh, sometimes it's working for me. This, the neck tight, I'll do just like, here, I'll show you what I do on like nights where I'm not using tretinoin. I'll do 2 to 3 pumps of my neck tight and just apply it up, 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 up. And people on YouTube were saying like I have a long neck, which is so mean, but I mean I do. I have a long neck. Somebody even asked me about that, like a neck lengthening procedure. I'm like, oh my God. I was a ballerina though, so it did come in handy. But people can be so mean. Okay, now my spray tan's off even more. But all these actives are gonna be working, increasing collagen, increasing elastin, increasing glycosaminoglycans and extracellular matrix proteins to keep that skin plump and juicy and hydrated and tight, and to keep the cellular renewal going to rejuvenate this area. And it has argireline in it, which is basically like topical Botox. It affects the snap snare complex to help relax the muscles, which smooths out the skin on the neck. Next couple things that I wanted to talk about: turkey neck, tech neck lines, turkey waddle. What are some of the other terms that we hear? Neck laxity, turtleneck. What are some of the other words that you guys come up with? But all these terms are terms of changes that happen over time as we gain wisdom and have birthdays. So some people will have horizontal neck bands, which we call tech neck lines. They could be anatomical, or they can happen with age, looking down at our phones, or they can be anatomical and worsen with age. There's different treatments for that. Usually Botox along the neck bands, skin Vive helps a lot. Hyperdilute radius is going to help a lot, but lasers aren't really going to fix tech neck lines. It's a different mechanism of action for treating a certain physiologic change that happens in the neck, if that makes sense. I hear myself talk and I hear like I'm being super scientific, but I don't know how else to articulate the changes that happen, and the treatments that address those changes have to match. Meaning you're not going to do thermage for a tech neckline and have it go away. You can do thermage for crepey loose skin in lieu of a neck lift, and that will help. But I hope you guys understand like the difference. So turkey neck or neck laxity or wrinkled skin on the neck, that does really, really well with thermage or any energy-based device. Fraxel, it does really well with. Combining them, Thermofrax does really well with neck laxity. Again, horizontal tech neck bands, not so much. That's going to be more Botox or a biostimulatory filler like Radiesse, or Skin Vive, which is like a micro droplet injectable for skin texture. Melasma on the neck, pico toning, Clear and Brilliant 1927 nanometer handpiece, poikiloderma of Savant or redness on the neck, that's V-beam. That would be the treatment for that. What are some of the other neck changes? Oh, platysmal bands. When you do this, if people are like that all the time, Botox along the platysmal bands, Nefertiti lift along the jawline, that's going to define the jawline. You wouldn't do a Nefertiti lift or jawline Botox for platysmal neck bands. I hope that makes sense. This is kind of advanced how I'm talking to you guys, but I'm talking to you guys like dermatologists, and I want you to elevate your level of education so when you're watching other YouTubers, you can see it clear as day. They have no idea what they're talking about. Also, if you want to go to a YouTuber who you follow, go to their website and go to their credentials and see where they did their residency. You'd be surprised how many didn't do a dermatology residency. Their family practice or their pediatrics, or they won't even say where they did their residency because they didn't do it in dermatology. Trust us. The ones of us who have done a dermatology residency, we're very proud of it, and we're of a very select few people, so we like to put that on our credentials. If it's not there, or if it's another specialty, it'll tell you a lot. So I'm trying to like elevate your level of understanding and to think like a dermatologist. What are some of the other things? So for example, Kybella to melt fat. Kybella is going to help with a double chin, but it's not really going to help tighten up loose neck skin. So you always have to think of the change that's happening on the neck and make an informed decision. What's happening in the skin and what treatment is that going to target? If I have pigment, I'm going to do Pico. If I have redness, I'm going to do V-beam. If I have skin laxity, I'm going to do a laser or an energy-based device. If I have a horizontal neck band, I'm going to do Skin Vive, Botox, hyperdilute radius, biostimulatory fillers. If I have, neck bands, then I'm going to do platysmal Botox. If I have a saggy jawline, I'm going to do Nefertiti. So just think in those terms, and trust me, you'll save yourself a lot of money and you'll be much more pleased with your outcomes from the treatments that you receive in office. Hopefully after watching this video, you learned a little bit about neck rejuvenation, rejuvenating treatments and combination of treatments that may be right for you. So hopefully after watching this video, you can make an informed decision on what treatments will be best for you, and I answered all your questions. And if not, drop a comment in the comment section and let me know what you want me to talk about for next week and any questions that I may have missed for this video.